The Euro-region Meuse-Rhine is a unique region in which Anglo-Saxon, Germanic and Romance cultures come together. The area includes the Dutch region of South Limburg, the German region of Aachen, the Belgian provinces Limburg and Liège, and the German-speaking community of Belgium. In this little piece of Europe, borders only play a minor role. This also applies to safety, as many examples show. Safety in the Meuse-Rhine Euro-region is guaranteed due to various authorities and organizations in charge of security tasks know and inform each other on a regular basis. Regarding security, this principle has been working excellent for many years. In the context of Emric Plus, this cooperation has been formalized and professionalized at various levels. The 16 members of the Steering Committee for Public Safety and Disaster have been meeting quarterly for decades now. The members are the top advisors of the public administration of all the sub-regions. The Steering Committee determines the general direction, discusses current affairs, oversees the implementation of the Strategic Plan 27 to 2013 and sets the plan for the period 2014 to 2019. At the highest level, they know each other, which is important when dangers have to be detected, assessed, prevented and fought.
Jetzt müssten wir uns eigentlich mal über mögliche Dekontamination unterhalten, dass wir uns da austauschen.
D'intérieur, on réunit du Nord en Allemagne. Et puis, on a demandé à Liège.
Doen wij verder, vervolgen wij onze vergadering, zodat we binnen de tijd en de termijnen blijven.
Par rapport à ces situations-là, on citera quelques exemples comme des exercices dans le cadre du tunnel de la liaison 25-40, le tunnel de Coire.
Emric Plus is leading a broad range of sub-projects that initiate and professionalize cross-border cooperation. All these sub-projects ensure that the actions against hazards are as optimal as possible. Thanks to Emric Plus, the citizens in the Meuse-Rhine can trust in this. UMIT focuses on mutual assistance in medical emergencies in the Euro-region. Cross-border assistance in the form of ambulance services and hospital care in the Euro-region Meuse-Rhine is a given. The medical managers in the field of emergency and trauma care are constantly updating the deployment procedures for cross-border assistance. Moreover, as it is very important to get to know the different methods and systems of the neighboring region, trainings and exercises are given. Using fleet mapping, the location of the ambulances can be established via GPS within seconds. If there's an ambulance in the immediate area, the responsible dispatch center can be informed immediately and direct the ambulance to the accident site quickly. Emric stands for cross-border cooperation in the field of fire services. It is important that Dutch, Belgian and German firefighters know each other and exchange knowledge. Meetings between the different regions have shown positive feedback from all sides. In the meetings they discuss the different methods and learn from each other. This exchange provides the basis for good cooperation in incidents. The highest officers of the fire departments in the Euro-region come together under the Emric Focus Group on a regular basis. This group makes arrangements for firefighting and rescue. The focus group also ensures the necessary training and exercises and makes sure that everyone knows what to do and what the rules are in case of cross-border incidents, for example, a major fire near the border. The major hospitals in the Meuse-Rhine have been working together for many years now. The hospitals include the University Hospital in Aachen, the Atrium Medical Center Parkstad in Heerlen, the Centre Hospitalier Universitaire in Liège, the Uni Hospital of Maastricht, the Jessa Hospital in Hasselt, the Hospital Ostlimburg in Genk, and the Orbis Medical Center in Sittard. Thanks to Emric Plus, the collaboration between the major hospitals in the region has, in many ways, become even more intensified and structural. Many doctors and staff have gotten to know each other better and show appreciation. Also, by sharing the processes on both sides of the border, assistance has extensively been simplified for serious incidents. The sub-project Emric works under Emric Plus to improve the clinical inter-IC transport in the Meuse Rhine. The aim is to maximize the use of available material. The cross-border cooperation should also ensure that different problems and obstacles are removed in the neighboring countries. All involved agree on these terms, which is why they have signed a letter of intent that can now be put into practice. Thanks to Emric, IC transports with mobile intensive care units MICU and IC ambulances between Dutch, Belgian and German hospitals in the region are no longer a problem. The Meuse Rhine has 7 dispatch centers that have frequent contact to each other. These are found in Maastricht, Hasselt, Liège, Heinsberg and Aachen. Efficient communication is guaranteed in the 600 cross-border efforts that take place annually. In the context of Emric Plus, the Meuse Rhine Euro-region has clear and carefully defined orders in which dispatch centers are accessible and when which alarm phase is issued. Thus, the right help is always fast and on the spot, without unnecessary inquiries. Each partner region has its own crisis teams. If hazards for other regions occur, for example a moving toxic cloud, competent teams can be convened in such a scenario. The available information can then be shared in accordance with the schedule. With the help of the Emric Plus app, the chairman of the various crisis departments can locate and reach the corresponding partner in the foreign neighboring region. Through this application, Emric Plus has created an efficient way of communication during crisis. The experts of CBRN RED, AGSs, consultants for hazardous substances, check for hazardous substances from large-scale incidents in air, soil or water. As an example, they take water samples for analysis purposes. These measurements, carried out with most modern techniques, are central to the work of CBRN Wide, which focuses on public health. The measured values are assessed from a toxicological and medical perspective. On this basis, CBRN advisors from Dutch, German and Belgian fire departments advise on the potential risks to humans, and the environment can be provided. Also, possible protective measures can be communicated. Emric Plus has made it much easier to reach a shared risk perception. Based on this shared perception and joint assessment of risk, CBRN Wide and RED give advice on protective measures for the population in the Meuse Rhine. This results in health risks for citizens and aid workers being minimized. The sub-project on infectious diseases originated from the fact that pathogenic viruses and bacteria do not stop at a country's border. An outbreak of an infectious disease in one country can quickly spread on another country. In a possible outbreak or incidental contamination, it is important that everyone is informed as quickly and thoroughly as possible. The Euro-region cooperation on infectious diseases leads to faster transnational responses in outbreaks, especially through the use of Euro-regional protocols and integration of reporting and response systems. The goal is to prevent people from becoming ill or dying as a result of infection. One of the objectives of Emric Plus is to develop cross-border agreements on risk communication between authorities and services with duties and responsibilities in the area of public safety. This has been a difficult task because the privacy legislation in the 3 countries is different, as an example. Among other things, the cultural differences also determine differences in risk perception. After a long time, the Dutch province of Limburg managed to include German and Belgian companies in the Dutch risk map. These first steps that have been taken are to raise awareness of the risks in the Meuse-Rhine-Jura region, in order to prepare for the effects of a disaster, as these effects would not stop at the border. In case of an incident, it is important that everyone, even the people in the Meuse-Rhine, are informed as quickly and thoroughly as possible. In the context of the Emric Plus sub-project Crisis Communication, a Euro-regional crisis plan is drawn up. This plan determines who receives what kind of information in the event of a cross-border incident. For this purpose of this tool, all chairmen in the Meuse-Rhine have access to an app that specifies who should be informed in case of an incident. All Emric Plus sub-projects together form an integrated system for managing crises with all available means. The Netherlands, Belgium and Germany attach great importance to this cooperation and a good crisis management system. For example, imagine that there are technical problems somewhere in the Meuse-Rhine during the landing of a passenger plane and the pilot loses control. When the crash of the unit occurs, an explosion and a huge dark cloud will rise in the sky. The control room of the affected area will, via Emric and UMIT, request for assistance in the field of firefighting and technical and medical assistance. Soon it is apparent that the capacity of the ambulances and fire engines is not enough. A request for additional assistance comes in the other control rooms in the Meuse-Rhine. The additional ambulances and fire trucks are alarmed immediately and proceed to the accident site. Thanks to Emric and UMIT, assistance in any case is clearly regulated. The various operations are proceeding according to the well-known and experienced care protocols from the Emric and UMIT plan. With the use of fleet mapping, the dispatch centers have a good overview of where the emergency vehicles are located and can direct these to the scene of the accident immediately. The officers on duty know where they need to provide assistance and where the wounded must be conveyed. This makes providing aid to the wounded on the scene of the accident run quicker and more smoothly. The LCMS system provides the necessary information. At the same time, the crisis management team is convened. Other regions have to decide for themselves whether they convene their policy team, given the cross-border risks. Through the app, all other policy teams can see the contact information and establish contact if necessary. For an overview of the situation, the teams can fall back on the LCMS and OSR. CBR in red and white take action during an incident. Liquids, gases and vapors released during the plane crash do not take account of a country's border. With the current weather conditions, they will soon reach the neighboring countries. As there is little time, the risk assessment must be efficient and flawless. Around the accident site, random soil and air samples are taken. Thanks to Emric Plus, the transnational cooperation in this area is well organized and reliable. The newest measuring equipment is shared across borders and deployed. It is determined that kerosene in soil and sewage has been spilled. From the burning aircraft, luggage and other cargo, a cloud of smoke, which may contain many different toxins, is formed. Joint measurements are carried out, analyzed and interpreted. In consultation with medical health advisors on hazardous substances, a defensive plan is drawn. It quickly becomes clear that risks exist for the environment and human health, because all measurements have been medically, toxicologically, chemically and radiologically assessed. The measurements indicate a high level of toxins in the air. Deep into the 3 countries, additional measurements take place. Citizens' health may be jeopardized by inhalation of the released gases. The crisis management teams in the affected regions decide to inform the public. All radio stations in the Meuse-Rhine are requested to send a warning message.
Und hier noch ein wichtiger Hinweis. In der Folge eines Flugzeugabsturzes in Maastricht sind giftige Gase entstanden.
Alle Menschen im 100,5 Revier werden gebeten, Fenster und Türen zu schließen und sich nicht im Freien aufzuhalten. Bitte lasst euer Radio eingeschaltet, wir halten euch auf dem Laufenden.
The crisis management team has announced that 5 passengers from Saudi Arabia had been on board of the aircraft. 4 of them survived the accident. They come from an area where the MERS coronavirus prevails. After all wounded have been treated, the health services be informed. Following a careful medical examination and laboratory analysis of samples taken, the 4 people are isolated. With a view to public health, extensive hygiene measures need to be taken. 2 of the 4 people exhibit symptoms of MERS. A specific diagnostic examination will need to take place, which will show whether the 2 passengers are MERS positive. As a result, more detailed information, observation and isolation is needed. All persons who have been in contact with the infected must be traced and investigated. For example, identify the passengers in the 2 rows in front and behind the infected in the plane. These people will be further investigated in order to prevent an epidemic in the Meuse Rhine. The partner region's relevant authorities are informed. Emric comes into play. The first passengers have been taken to the Maastricht UMC with serious burns. They have been included in the intensive care unit. It soon becomes apparent, however, that the victims should ideally be brought to the burn center of the University Hospital in Aachen. This requires interclinical transport with mobile intensive care units and ambulances. Thanks to the sub-project Emric, intensive care transportation can easily be organized. Those responsible for cross-border transport know each other. As a result, the available material on both sides of the border can be quickly identified and exploited. The victims of the plane crash are transported in nearby hospitals abroad and receive optimal care in hospitals near the accident site. Also, during the transport with an IC vehicle, optimal care at the level of an IC unit is guaranteed, so that the wounded dispersion proceeds without risk. The capacity of the hospitals are sorted according to need and medical specialities. Thanks to Emric Plus, the responsible medical personnel know of each other, which simplifies the agreement. This only serves as an example. The vast majority of air traffic in the Meuse Rhine runs extremely safe. Within Emric Plus, all parties agree to prepare for incidents. The cooperation outlined here in the Meuse Rhine between ambulance and health services, hospitals and fire departments from the Netherlands, Belgium and Germany is unique. National differences are hereby bridged to ensure safety. Emric Plus facilitates, coordinates, intensifies and expands the collaboration. Whenever human lives are at stake, the border should not be seen as an obstacle. Emric Plus works with more than 30 partners, and in total there are more than 140 people involved. Together, they have all the necessary organizational conditions, programs and tools. Within the Meuse Rhine Euro-region, thousands of people are concerned with safety. They now need to be trained, so that all those involved in safety consciously take into account the interests of neighboring countries. This also provides an additional important benefit. People on both sides of the border get to communicate and get to know and appreciate each other. This is essential for rapid assistance in case of incidents. Many thanks, therefore, goes to all those involved in Emric Plus.